I often get asked why I started a PhD, and the easiest answer that I can give to this question is to describe a patient that I met in my new graduate year while working as a physiotherapist. And for today, we'll call him John. So I met John when I was working on the rehabilitation ward after he'd unfortunately suffered a large right-sided stroke that was affecting the left side of his body. But what was more unique about John than my other stroke patients was that he had a condition called unilateral neglect, which is a fascinating condition because it results in the inability to perceive or respond to stimuli that happen on the opposite side to a stroke. Now, there's nothing actually wrong with the eyes in unilateral neglect. It's more that the brain is failing to process everything that's happening on one side of space. And it's a really important condition too, because it affects about a third of people after stroke, results in poorer functional outcomes after rehab, and reduces the likelihood of going home when people are actually discharged from hospital. But this was not the only thing that stuck out to me about John, because John also had impairment in what's called proprioception, which is equally as fascinating as unilateral neglect because it's kind of like our sixth sense. Proprioception enables us to tell where our body is in space at any given point in time, and it does this by giving us information about the degree to which our joints have moved, the forces that our muscles are exerting, and also what the moving parts are, so our concept of our body and what it is that's stored in our brain. So John had these two impairments, and being a new grad physio, the first thing I did was go straight to the literature to see what I could do about them, and I found three main things. The first was that unilateral neglect and proprioceptive impairment seemed to be related to each other. However, the second was that there was no comprehensive assessment tool for either of them, which meant that treatment options were really limited for both. And the third was that no assessment of unilateral neglect actually included a direct measurement of proprioceptive impairment, despite the two seeming to be related to each other. So I had limited options with John, and unfortunately, he followed the usual pathway of a neglect patient in that he was discharged to a nursing home, unable to stand up by himself. And this is what my thesis is trying to change from a very clinical perspective. My thesis aims to investigate how clinicians currently understand and assess both unilateral neglect and proprioceptive impairment, so that we can identify the gaps in clinical practice in this area and design targeted translational research to fill them, including designing a more comprehensive assessment of unilateral neglect that includes a measurement of proprioceptive impairment, so that patients like John stand a better chance at a good functional rehab outcome and going home when they're discharged from hospital.